The angled or beveled tip is the area that transmits and receives the Doppler signal. Apply water-based gel to the tip of the probe and insert into the patient's esophagus as early as possible to let a good mucus bond develop. This is recommended straight after intubation, as this allows a settling in period and early monitoring. 3 depth markers are visible along the length of the probe. Their purpose is to guide you to the T5-T6 region. Line marker 2 or deeper for the incisors for oral insertion, or marker 3 or deeper with the nostrils for nasal insertion. The probe needs to face the descending thoracic aorta, and the signal is clearest where it runs alongside the esophagus. This is usually around the level of the 5th and 6th thoracic vertebrae.